Today, SSPTV Community News is pleased to be here at the Valley Country Club in Sugarloaf. We are here for the Greater Hazelton Chamber of Commerce Women's Networking Luncheon. And the lovely speaker for this event today is joining me now, Dr. Lori Alphonse. Dr. Alphonse is with the Lehigh Valley Health Network. She is Deputy Physician-in-Chief of the Topper Cancer Institute. She is also a breast surgical oncologist and a very busy lady. So we are very pleased to have her join us today. She will be speaking very shortly to the women that are here today for this wonderful luncheon with our Wear Pink mottos today. October is Breast Cancer Awareness Month. So obviously that's why they wanted you to come and bring recognition to this. How important is it that we recognize October as Breast Cancer Awareness Month?
You know, Lehigh Valley Health Network prides ourselves on excellent patient care. And I have to be honest, everybody knows October is Breast Cancer Awareness Month and they wear their pink. We are aware 365 days a year. I'm very happy that October's been dedicated to breast cancer awareness and even more importantly, breast health awareness, and that's what we'll be talking about today.
What advice would you have for our viewers as far as screenings and what to do, since they're not able to be with us here today at the luncheon? So give them some advice which would really be important to them.
My first recommendation is to have a screening mammogram beginning at age 40, regardless of your family history. I hear so many people say to me, I don't have any members in my family, I don't have anybody that's had breast cancer, but the biggest risk that a woman has is living long enough to get it. Starting at age 40 allows us to have a baseline mammogram, a starting point, so that we can compare going forward. The second big recommendation I have is pay attention to your body. I have a lot of women who say to me, I don't do breast exams. I don't know how to do it. And you know, there's no real formal mechanism to it. You just know when something's wrong. I joke, and when I'd like to elaborate when I say you know when something's wrong, I joke with my patients and I say I don't own a thermometer, but yet I know when I have a fever, right? So you know, as women, we know our bodies better than anybody. And if you notice something, an abnormal rash, a nipple discharge, something like that, bring that to the attention of your primary care doctor or OBGYN for further investigation.
Are people getting the message, do you think? Are more and more people taking advantage of the screenings and doing what they should do?
I think they are, and the reason why I say that is we look at incidence or how many breast cancers there are out there, and there's a lot. We're finding a lot on screening mammograms. So a screening test, if I may explain, is a test that finds disease before disease finds us. So many women sit in front of me with a breast cancer diagnosis, and I also want you to know, men out there, men can get breast cancer also. But women sit in front of me after a screening mammogram and say, I feel fine. I didn't feel anything. But yet they're telling me that I have a small cancer. That's exactly the best time to find it, when it's most curable and very, very small.
Are we seeing more breast cancer, or is it just because we're doing more tests to find it?
I think it's a combination of two things, I'll be honest. First and foremost, we're very, very diligent about recommending screening mammograms starting at 40. If somebody does have a significant family history of breast cancer, perhaps they need screening earlier, and that is something that they should discuss, again, with their primary care doctor or their OBGYN. I think the second contributing factor are the environmental factors that cause breast cancer. We all know about the genetic component, you know, the Angelina Jolie component where her mother had a BRCA mutation, the Christina Applegate, advertisement when she found out because she had a genetic mutation. But 85% of all breast cancers are not genetic mutation caused. They're environmentally caused. Air we breathe, water we drank, food we ate, and stress we were under. And those are things that really, combined with age, are causing, I think, more incidence of breast cancer.
But the good news is there are more survivors, there are more treatments.
We are living a very different way to treat breast cancer than we did 20 years ago. We have targeted medications, we have clinical trials for the tricky breast cancers, and I like to clarify in saying that women that are walking around today after having had breast cancer, I like to refer to them as thrivers, not survivors. And what I mean by that is Survivor is a TV show. It's a very popular TV show, but these people are living on islands, they're eating bugs, and they're hanging on by a fingernail. These patients that have been through breast cancer treatment are getting on and living wonderful, happy, healthy lives.
We have a new cancer center being built right here in Hazleton. How important is that? I mean, we do have cancer treatments available locally right now, but how important is it that we're going to have this brand new facility?
Lehigh Valley Health Network and specifically the Topper Cancer Institute, prides itself on excellent patient care. And cancer care is a team sport. Having a cancer institute where all members, surgery, medical oncology, radiation oncology, social support, nutrition, navigation services, they are really what make for the fabulous outcomes, and more importantly, the pathway for our patients to get through this sort of tricky scenario, this tricky path that they've been asked to take. Doing it on a team sport level is what the Cancer Institute here at Hazleton is going to be able to provide our community.
And I see that it's the Topper Cancer Institute, but it's also with the Memorial Sloan Kettering Cancer Alliance. What does that mean for people around here? What does that mean to us?
That's a great question. So a lot of times we drive on the highway. I know I drove up here, saw lots of billboards, and sometimes we see health networks or hospitals with a little blurb in the upper corner of the billboard affiliated with XYZ. An alliance is actually a true working relationship. Memorial Sloan Kettering is the oldest private cancer hospital in the world. If somebody has a very rare cancer, chances are they've seen more than one or two. And we were the second of 3 alliance sites chosen. They saw our standards of care. They saw our treatment patterns. We have since aligned with them. And so when somebody comes to Hazleton Cancer Center, they are actually getting the standard of care that people would get if they were being cared for at Memorial Sloan, but they're getting it right here in their backyard. I just want to remind everybody that breast cancer is a very, very treatable disease. Lehigh Valley Health Network is dedicated to taking care of people. Now remember I said that. We take care of people, not diseases, not disease processes. We take care of people who have cancer. We take care of people who have had cancer, and we also take care of the people who care for them and about them.